Welcome to the Asia and the Pacific Policy Conference 2014, hosted by the Crawford School of Public Policy at the ANU. My name is Belinda Thompson and I'm here with Tikki Pang. Tikki is an APPS editor and he is also a visiting fellow at the Lee Kuan Yew School of Public Policy at the National University of Singapore. Tikki, thanks for joining us.
Pleasure.
I just wanted to ask you, first of all, how did you come to be involved in the conference?
Well, I was at the Lee Kuan Yew School when I met Sung Lee, one of your collaborators, and when he moved to Canberra, we kept in touch, and clearly the two schools share a common vision, a common goal. And when he began organizing conferences soon after he moved to Canberra, he invited me to participate in a conference about 2 years ago. And of course, being an ANU alumni, I need very little excuse to come to Canberra. And then subsequently, I was invited with Kelly Lee to be guest editors of a special theme issue on health in the Pacific. So that's how I got connected to the Crawford School. And just anecdotally, I actually received my degree in 1977 from Sir John Crawford himself. So there is a bit of a sentimental attachment to the Crawford School.
So you've got a vast history in global health and in public health. You've worked extensively with the WHO. How does Pacific health differ from health in other regions around the globe?
I think it differs in the sense of several dimensions. Firstly, I think the sheer diversity of the different countries in the Pacific, the fact that geographically they're very sort of spread out, the fact that I think compared to, say, the nearer neighbors in Southeast Asia, they have fairly small populations. So that presents a set of logistic challenges. It also translates into slightly different health problems that the rest of the region faces. And in particular, I think chronic diseases is a significantly higher problem in the Pacific Islands than, I mean, it's still important, of course, in Southeast Asia, but there is something unique about the Pacific Islands that presents special challenges in health, let's put it that way.
Now, given your vast experience in global health, sitting in the conference over the past 2 days, has there been anything that's really surprised you?
I think what's particularly surprising to me was, and although I had known about this before, the extent of the dependence of many Pacific Island countries on external development aid for running their own healthcare systems. That was a little bit of a surprise, although I've seen the figures, I've seen the statistics around that issue. But when I actually heard from people from the countries themselves, I was actually quite surprised at actually how dependent some of these countries are on foreign development assistance for what is essentially a national responsibility. So that's a bit of a worry, because at the end of the day, I think, you know, when you have a country delivering healthcare to the people, it's got to be a national responsibility. You can't have that key service be dictated by foreign donor agendas. I'm not saying that it is, okay, but it is just a bit of a concern. And perhaps that's probably the surprising thing that I took away from this conference. And I hope in the future there will be more government commitment, so that there will be less of a dependence on foreign assistance, and essentially becoming, I mean, it's the adage of, you know, you give a man a fish, you feed him for a day, you teach him how to fish, you feed him for a lifetime. So I think the longer term goal would be towards more sustainability, self-sufficiency, and basically controlling your own destiny in the future when it comes to healthcare.
Now, tobacco control, just shifting the goals a little bit, tobacco control is a huge issue globally. What do you see as being the particular barriers to getting tobacco use under control in the Pacific?
Okay, I think especially in the context of chronic disease, tobacco is clearly a key risk factor around, increased risk of heart disease, cancer, respiratory diseases, even infections like respiratory infections and TB. So it is very worrying that smoking prevalence rates, especially amongst younger males in the Pacific Island countries, is very high. And you rightly point out, despite having very good instruments, policy instruments like the Framework Convention on Tobacco Control, there has not been much of an impact in reducing, the prevalence of smoking in Pacific Islands. I think there are several challenges and barriers. Firstly, I think it is a question of primarily political will and commitment. So whether or not the governments in these countries have the political will and commitment to actually implement some of the articles. There could be economic concerns around how much countries actually gain from the sale of cigarettes in terms of tax revenue. So that could be an important dimension. Governments may not want to reduce smoking because they fear that their income from taxes from tobacco sales could decrease. So there is a political will, there's an economic dimension. I think there's also a very important behavioral, cultural dimension. If smoking has been essentially part of the growing up, getting young people to stop smoking is a behavioral change kind of challenge, which sometimes is not easy to address because there's a lot of peer pressure. Young people think it's fashionable to be smoking. So it's a series of different kind of barriers. But I think at the top of it is probably political will and commitment. Unlike Australia, which has had a very strong commitment towards implementing some of the measures that would reduce tobacco use. For example, really increasing the price of cigarettes, and secondly, making sure that cigarettes now only have plain packaging. You can't put brands anymore. But in the Pacific, I think there's some way to go before you reach that level of implementation of the convention. Yeah.
So to keep improving health, how important do you think research is on an ongoing basis in the Pacific?
Well, it's clearly very, very important. And you're talking to a researcher, so I'm a member of the choir, so to speak. But let me just say that I think there are two dimensions of this. It's very important for the Pacific Island countries to build their own capacity. But I'm going to put a qualifier to that. Their own capacity to do what? And essentially, it's to do two things. Obviously, the first thing is to be actually doing the research themselves. You can't just rely on other researchers in Australia or New Zealand to be doing the research. You must have the capacity within your own countries, within your own research institutes, to do your own research, especially on the problems that affect your own countries. Okay, so you need that capacity. But in addition to building the capacity to do research, these countries must also build the capacity to use research. And that's an important distinction because a lot of research is like an end in itself, okay? Whereas the use of research, okay, is much more important in terms of improving health outcomes. So I'm saying that in addition to publishing papers, doing new research, you must also be able to make use of research to inform, for example, best practices and importantly, development of health policies. Because especially in countries where resources are limited, you need good evidence to make sound policies. And in fact, there's a saying that because a country is poor, it is more important that they base their decision-making on the best of evidence. because you have to get maximum bang for the buck, basically. So that would be my message in the context of research. Don't just build capacity for doing it, but build capacity for using it so that you have more robust health policies.
Thank you so much for your time, Tikki.
Pleasure.